Hi friends of Boston Coalition for Autism. Thank you for watching our videos. And this is one more presentation for you guys today. Thank you for all your responses and questions. And today we are Farm Pond Woodland Park. So this is a park near some fields, some baseball fields. Very popular, especially this coming summer. And the leagues are really good here. They have a different ages, different levels. But also we have an elementary school there, Barbieri Elementary School. And then we have the lake. The lake there is one of my favorite lakes because the swamps. But today we're gonna talk about addictions in autism. And it's a plural because addictions, as you know, there's a substance addiction, there is a behaviors addiction, like a gambling and many others. Even the screens, the all the media, the social media, that's is developing a addiction, and is one of the um, highest growing addictions in the field of mental health. So my recommendation is use it in a measurable way. But then we go back to addiction, and autistic people has historically been unrecognized. There's many factors. There's a lot of misunderstood and often misdiagnosed. For many years, the clinicians focused mostly on autism in children with the visible behaviors. So we talk about the visual behaviors for children, while addiction research focuses on autistic adults. Is what we are talking about. Look at that beautiful bird. Yeah. And if you see it far away, the white spots are the swans. So the intersection between autism and addiction only began receiving more serious attention in the late 2000s. So especially during 2010s, when researchers started noticing patterns of substance abuse and related to behavioral addictions, and also the burnout, trauma, masking, and mental health struggles in autistic adolescents and adults. And we know what all those means. All those behaviors at certain time, they have to manifest. And unfortunately, they do it in a bad way. And that's one of the goals of the information of this video, is to have a better mental health um, options. So today, addiction and autism is increasingly recognized as important public health and mental health issue. But there are still major gaps in diagnosis and treatment and understanding. We have visited a couple of centers where they don't have any idea of what we're talking about, addiction and autism. They see them all addicted people, but they don't distinguish between neurotypical and neurodiverse people. So that's a major issue too. And why addiction and autism was often missing, there is some multifactorial reasons. Many contributed to the delay in recognition. Delay. So but I mean, what's first? Addiction and autism is obviously that is autism, but when the addiction manifested is where the problem starts. Being noticeable. Not that it starts. The problem starts already for misconception of autism. So autism was mostly seen through a childhood lens. And this is a topic that we talk about all the late diagnosis, males, females, and addiction also. And you know, addiction could be in males and females. Some of the centers for addiction, they have most men because the judicial system sometimes, but not because it doesn't exist in that many females. Some females prefer to be doing at home or in a private settings, but still addiction exists, especially when it's not alcohol or it's not a social behavior. So, for decades, autism research only focused on children, especially boys, and with higher support needs. So many autistic adults, especially females, immigrants, and intellectually gifted individuals, and people with concurrent ADHD were undiagnosed. Sometimes the addiction, ADHD is a big addiction producer for calling some way. Problem runs calling that way, but a lot of people with addiction has ADHD, and also uh, there's a lot of factors involved with the ADHD and addiction. So as a result, clinicians often treat anxiety, depression, or addiction without recognizing the underlying autism. So they don't see it. And like we said in previous videos, some professionals are not prepared to identify autism. So they have the tendency to masking and social camouflage. Many autistic people learn how to mask the differences to survive socially. They try to be socially alert. And so sensory overwhelm is another thing. Sometimes they try to um, use anesthetics, let's say, for the substance to do that. So emotional pain, the rejection, dysphoria is another thing. It's a co-occurrence of autism. So they try to reduce the stress of emotional pain by being under the influence of some substance. Sometimes the exhaustion of masking. They're very tired of masking, and then the solution again becomes the substance or the behavior. And feelings of alienation, that's not too much a no, but those feelings are real, are there too. This sometimes led to self-medication. Partners, rather than they use whatever medication had in the past for sorry, I'm kind of stuck. Recreational uses. So, and that's mean if somebody was like prescribed with some kind of a narcotic or something similar, they reuse it for recreation. So that's the point. And the misinterpretation by professionals is very there. Autistic freaks were often misunderstood, and they take it as a personality disorders. Also, oppositional behavior. Sometimes the lack of motivation too, emotional instability, and non-compliance, and obviously the trauma only presentations. So for those who are following us that are very educated on autism, you know that these are common things that is not out of the radar. So, but if you are not, then follow us, and then you can learn more about all these behaviors. Because meanwhile, addiction treatment programs were usually not designed for neurodivergent. Communication is still the styles and social needs are either. So all the rehabilitation programs, they are thinking of neurotypical people. They are not. At this moment, the research tells us that nothing around us on neurodiverse people addiction treatments. So then you can add the co-occurring conditions. Autistic individuals may also experience the ADHD. We say it several times. 40 to 70%. Some studies reveal that people on autism has ADHD. So the anxiety disorders. A lot of females are diagnosed first with anxiety than other things. Yeah? Depression. And if you see a lot of connections between these symptoms and PTSD, post-traumatic stress disorder, is another. And alexithymia. The definition of alexithymia is the lack of understanding feelings of other people or their own feelings. That's alexithymia. So we can see here the skateboard cord. So we can see the practitioner there. Right. So another factor is a chronic loneliness. Most of the people in the spectrum, the social implications that autism incurs, they prefer to be alone, or they don't have the ability to create friendships or stay away from people. It's one of that's personal desires. So that's another thing. And chronic illness. Sometimes they cannot manifest their illness. It's chronic, and they use the substance to as a medication. So other sleep disorders. There's a lot of sleep disorders in autism. It's over 20% of the people. Some studies reveal that 30% of people in the spectrum have sleep disorders. But let's be a little bit conservative and let's go for 30%. All right, let's see. I don't know what animal lives there, but it's kind of big. So let's stay away, because if they have babies, they can become aggressive. So then some other things, executive function difficulties. Why the executive function? Because the inhibition and the control of behaviors is mostly on the cortical frontex, or prefrontal cortex, where we have the executive functions, and one of the functions is inhibition or control of behaviors is there too. So that's another part. So this can increase vulnerability to the addiction. And if we don't have the supports, that's normally going there, or a lose-lose situation. So that's why we have to have our open eyes, and that's why it's part of the purpose of this video, to create supports. Yes. So what kind of types of addiction can appear in autism? Because addiction is not limited to substances. In autism, it can include both chemical and behavioral, more than the regular population or neurotypical. Most of the neurotypical population, they use substance, but in autism, it can be a high number of both chemicals and also behavioral. You see this a little part of the lake. It's a little bit like a swamp. Sorry, and that's what we can see, the swamps. If you look closely, there, I think that's a nest. Let me see if I can expand. Yeah, that's a swamp and a nest. We don't want to disturb. But let's go back to our video. Probably we can see it from behind. So, and so the substance related, we can see alcohol, which is the most popular, cannabis, nicotine, prescription misuse, stimulants, and opioids. So those are the most typical, but not limited, because we have some behavioral. Which in the behaviorals we can classify the gaming, the internet, social media, and gambling. So let's make sure that we understand both. Gaming is like video games. Gambling is like a betting money or goods. So, oh yeah, look, see. We can see the nest right here. Huge. That's never seen a nest of a swamp. So let's move away and let them be. So other gambling right now is growing in the United States because the companies, the gambling companies, they are lobbying a lot, so they are creating new laws so they can gamble, and it's more permitted. And because the media is electronically uh, friendly, so I can use my phone to bet and lose a lot of money. And these companies are not there for losing money, so they are there for winning your money. So just not much to say. Also, pornography, there's another factor, and if you consider loneliness and other factors, they can take people in the spectrum of to that area. And shopping, people shops it's a lot of emotional involvement, plus it's a impulsive disorder too, and so there's different factors to have the shopping to become one of the addictions. Food related too, and impulsivity again, frontal cortex again. So work, people is addicted to work sometimes, and over functioning, and also they're trying to compensate for different things. So that's a lot of people who use it in working and working is an addiction. Workahol is alcohol. But another thing, exercise. You've been to the gym when you go in the morning and you go in the afternoon and you see the same person there. It could be for physical challenge, but also it could be addiction. It's a lot of dopamine involved in exercising, and so that's a very common thing to see. Well, if we go to the statistics, if you have 31 people in the gym, at least one is an autistic person. So those are numbers, hard numbers, hard data. So we're not making it up, and that's a proof of that. So some repetitive behaviors may resemble addiction externally, but it's important not to confuse autistic self-regulation or special interest with pathological addiction. So we have to use differential diagnosis to understand that part. What it is first, and what has the foundation of autism, because it's very easy to misunderstand it, and that's why we have a poor treatment because of that. Uh, so this is the part one of this video. We're gonna move to another part, and we're gonna continue with this addiction and autism. So please stay alert for the next video in this series, and hope to see you there. Your friend Mauricio Perea, Boston Coalition for Autism, and thank you for being here. See you in the second part.